The scanning starts with the proximal end of the probe on the medial epicondyle, ensuring the distal end is aligned horizontally, independent of the ulna's longitudinal axis. This orientation facilitates an optimal sonographic depiction of the medial epicondyle with a common flexor tendon above it, the inferior epicondylar aspect with the anterior oblique ligament of the UCL above it, the humeral trochlea, and the coronoid process of the ulna. From here, we gradually slide the probe distally in a strictly horizontal orientation until the medial epicondyle is no longer visible in the sonogram. This movement repositions the humeral trochlea and the coronoid process of the ulna to the left side of the sonogram. For the context, the superficial muscle here is the flexor digitorum superficialis, the ulnar head of the pronator teres muscle over here, with the brachialis muscle and its tendon over here. From this position, we start sweeping the probe anteriorly toward the forearm's midline, with the coronoid process fading off the view and the radial head emerging, producing a distinct hyperechoic signal with the anechoic hyaline cartilage covering the radial head itself. This maneuver effectively displays the sequential anatomical landmarks across the sonogram, where the radial head on one side resembling a hill, the radial neck in the center like a gentle slope resembling a valley, and the radial tuberosity on the other side appearing as another hill, collectively resembling an arc, the radial arc. For the final step, we ensure the radial tuberosity remains on the right side of the sonogram. Then we keep the distal end of the probe stable while pivoting the proximal end of the probe upward by about 15 degrees. This maneuver aligns the distal biceps brachii tendon in its long axis view through the pronator teres window. At this location, dynamic assessment of both tendinous heads can be performed by rotating the forearm between pronation and supination.